Strong emotional or physical pain makes people view reality in all or nothing or black and white ways. I'm in complete agony. I want to be completely comfortable. I'm utterly miserable. I want to be happy. Using scaling in therapy with your clients and helping them break down their perception of their situation into grades accomplishes three things. 1. You put a fence around the experience so that it no longer feels limitless and uncontrollable. It becomes more manageable and therefore more hopeful. 2. You help them step outside their experience by observing it and engaging the non-emotional part of the brain to scale or grade their pain, anxiety, misery, motivational level, or whatever it may be. And 3. You break down expectations and therapy strategy into discrete steps, rendering them more realistic and achievable.
It's just complete agony.
It must be horrible to have that sense of pain so much of the time.
Yeah, I can feel it right now. It's more in my back. It's awful.
So you feel it right now in the small of your back. And if 10 is the most agony it's possible to feel, the worst pain, and 0 is complete comfort, where is it most of the time, do you think, on that scale?
8.
About an 8?
Yeah.
Okay. And what about right now?
I would say 7.
7.
Notice how Mark has pretty instantly reframed pain as numbers. So now they've gone from being in agony to being at 7 on a scale of 1 to 10. A small step, but it's a start. Of course, they might say 10, in which case you can begin to ask solution-focused questions such as, what will be the first indication that the discomfort has gone down to a 9? In order to access the answer to a question like that, the client needs to, on some level, experience that improvement. Scaling also serves to help the therapist gather information as to what the client's goals are. This basic scaling can also be used for psychological pain.
If 1 is the most depressed you've ever felt, and 10 is the happiest it's possible to feel, where are you right now?
I would say 4.
4.
Mark has introduced the reality of a subtle continuum into the experience of depression. Rather than being depressed or happy, the client can use their observing self or thinking brain, the neocortex, rather than purely operating the emotional parts and begin to see the pattern of depression from the outside. Mark has a chance to learn what is enabling this client to be a 4 and not a 3, and can also ask questions about what will be different when the client gets up to a 5, then a 6, and so on. Depression thrives on all or nothing thought, so this kind of questioning can really begin to introduce some moderation of perception. It doesn't matter whether 1 or 10 is the most or least, as long as you explain it clearly to the client what the scale means and are consistent with it. Grading or scaling is effective for anxiety because it demands the engagement of the thinking brain, which itself loosens the grip of the emotional brain. Using scaling in therapy gets the conversation switched from being about emotions to being about numbers, and this in itself can help people feel calmer.
Okay, so if 10 is the most anxious, it's possible to feel the most terrified, and 1 is the most relaxed, it's possible to feel. Where would you say you are right now?
Well, then I would say 5.
5, okay.
Oh, yeah.
And what we can do is just explore the experience of being a 4 or lower on that scale. So maybe you could put your feet on the ground, put your hands to the side, and just begin to imagine what it's going to be like to breathe your way down to a 4. You know, the way the facial muscles are when they relax more, and the way the hands feel maybe a little warmer as you begin to feel more comfortable, and those eyelids could feel a little heavier as they relax. You can close your eyes and just really getting a sense of being on a 4, what it's like to be down to a 4 on that scale. Just feeling a little freer, a little more relaxed, maybe the mind drifting somewhere else, somewhere you've been more relaxed before. And you even get the sense of being a 3, the kinds of ways the body feels relaxed when it's down to a 3 or even a 2. You can even picture a 2 in your mind. That's it. And what it feels like to really begin to rapidly feel so much calmer, more peaceful and restful.
Notice how Mark suggests that his client imagine what it might be like to relax down to a 4. Of course, imagining a level of relaxation and actually experiencing it are pretty much the same thing. He short-circuits the black and white perception of "I can't relax" by having his client relax a tiny bit more at a time, but not too much.